Okay, so we are going to talk about the veterinary practice, especially when it comes to safety and OSHA, what that means for employers, employees, certain hazards, exposure possibilities, zoonotic diseases, and we're going to touch on all those in detail here in this lecture today. Hang tight with me. It's going to be quite a hefty lecture because we've got a few topics to cover. But let's go ahead and without further ado, get into this. Okay. So we've got our objectives. So we're going to list terms used when we're talking about veterinary hospitals, discuss different safety issues with OSHA regulations, and then importance of establishing sanitation protocols, procedures to help control possible infections when we're talking about being in a veterinary clinic or a hospital. Okay, so we are going to provide the best medical care for our patients. That is definitely our goal. We are striving to make a workplace that is friendly, efficient, safe for all of the employees, and then, of course, excellent customer service to our clients because even if you got into veterinary medicine or are looking to get into veterinary medicine because you want to work with animals and not quite the biggest fan of people, all pets come with owners, right? If you go into shelter medicine, that's definitely an exception to that case, but patients are going to come with their owners, and so we're definitely going to have to make sure we treat them as well. Okay, so let's get into types of practices. So when choosing a practice, a lot of owners, according to an AVMA survey, they choose their clinics based on location. So, whatever is the closest and most convenient for them, they want to be able to take their animals there. Maybe some other considerations that an owner might have for taking their animals somewhere would be maybe the specific doctor. I've worked with doctors that clients actually follow them. So they'll actually go from one clinic to another specifically to follow that doctor. I've had clients follow me as a technician as well. I've also had clients choose a certain clinic because of its urgent care possibilities, because it's an emergency clinic, different things like that. Everybody's just going to choose based off of their own preference. Species seen is also another big one. So, if an owner has like a leopard gecko, a rat, a snake, plus or minus a dog or a cat, they might want to go to a clinic that's going to accommodate all of those pets, so they're not going to multiple places. We have a few different types of veterinary practices. So small animal is mainly dogs and cats. They can include other smaller species as well. Like Banfield is going to make sure that they see the patients that are in PetSmarts as well. So they may do some care with guinea pigs, hamsters, things like that. But small animals, mainly dogs and cats, so companion animal. We have exotics, which is pocket pets, different reptiles, so snakes, tortoises, turtles, birds, different things. But they're all going to be fairly small. Of course, turtles and tortoises can definitely get quite large. Equine is going to be horses only. Sometimes they're going to do equine and large animal, but a lot of times there are just equine places. And then large animal would be, your cows, your goats, your sheep, pigs, things like that. And then mixed can be anything. So we're going to explore some veterinary practices here in Tucson, and we'll talk about maybe what they see. And then different facilities can be a clinic or hospital. They can be emergency, specialty, spay neuter, that's really all they're focusing on. They're not going to have everything. They're just going to really focus on getting animals fixed and out the door. And then, of course, mobile. So they come to the client. So a clinic will probably be a smaller facility. They have a small amount of staff. They might be unable to perform certain procedures. So things like endoscopies or specialty surgeries, whether based on lack of staff or expertise. Outpatient only, so they're not going to offer overnight care, hospitalization. They might do initial care for that animal or for that patient, placing an IV catheter, getting started on fluids, medications, diagnostics, and then once it comes towards closing time, that owner is going to have to pick that animal up and transfer them to another facility. in which case we could send records, call them in ahead of time in advance, make sure that they know that that patient's coming and that they have space for that patient. COVID was definitely a challenging time for a lot of clinics, and so not everybody had the space and availability to take in more patients. So again, things that might not be available: endoscopy, ultrasound, although more and more those small clinics are getting the capability of doing an ultrasound, if not for completely diagnostic reasons, just a preliminary. Different specialty surgical procedures. So orthopedics is a big one. So actually cutting into bone, it's really going to have to go to a specialist or a surgeon. Emergency care, overnight care, there's nobody there. So we're not going to hospitalize a patient that has nobody there to keep an eye on them. So no 24-hour staffing, no late or weekend business hours. A lot of times, actually, clinics will be open for like half a day on Saturday, and that's their weekend availability, but they won't go beyond that. So they won't do a full day Saturday. They won't be open at all on Sunday. And that's just based off of, business needs, but also for their staff. So some local clinics here in Tucson: University Pet Clinic, Rolling Hills, Eastside, Pantano, Northwest, Santa Cruz. Of course, that's just a few. There are definitely many, many veterinary clinics. The more you're aware that there are many, many out there, as you're driving down the street, you might even pass a couple. So going on to the hospital, hospital is definitely, when you think about a hospital, you're going to think about a big facility, one that's going to have multiple departments and be able to do quite a lot more. So they're going to be larger. They're going to staff more than a clinic. They can still be somewhat small, but they're going to be larger. So they're going to have multiple doctors on the premise, especially at a time. They'll do inpatient and outpatient. So these hospitals will actually admit patients to the hospital and keep them overnight, 24 hours a day. And a lot of them will also be open on, say, like the weekends. It's really just dependent on what their business is specifically. Sometimes that overnight care isn't a doctor and a technician. Sometimes they're not open to the public, but they do have somebody there, either only on the nights that they have somebody admitted, or every night, just kind of maintaining the facility as well as caring for any patients that are hospitalized. So some might be VCA Animal Medical Center, Central Animal Hospital, Ina Road Animal Hospital. One of my classmates that I went to school with, she works at Ina Road, and she did some overnights for quite some time. And so anytime they had a hospitalized patient, she was the one to care for them. And then there was always be a doctor on call. So someone that she could call if she had any concern. So as she was checking their vitals, checking their fluid levels, and then whatever condition that they were hospitalized for, she was monitoring that progress. And then Orange Grove Animal Hospital as well. Orange Grove is really nice as well because they do exotic work as well. So emergency facilities are equipped to handle all kinds of emergencies. So they're going to have multiple doctors on every shift. A lot will be either like on call, or they do actually have a doctor on premise the entire time, all 24 hours. And then typically during the day, they're still going to provide full service. So full service meaning general practice. So wellness exams, basic illness exams, surgeries, stays, neuters, dentals, all that fun stuff. And then oftentimes they'll have more advanced diagnostic machines. So whether that be a CT machine, an MRI, both, different things like that. Endoscopy is a pretty common one for them to have. And again, they're going to be there 24/7. You never know when emergencies are going to happen. So some of those local ones are VCA Valley Animal Hospital, SAVS, which is what we call it, so Southern Arizona Veterinary Specialty Center, VSCOT, which is the Veterinary Specialty Center of Tucson. So this one here on the left is going to be VSCOT. The one on the right is Valley. It's VCA Valley now, and that's just the emergency side that we're looking at. They've actually expanded further on to that left side to have more of an area for general practice. So they've got, I think they're up to like 15 or 16 exam rooms at this point. They're definitely considered full service and emergency in that case. So specialty centers can be referred to as referral centers. Now, they don't always need a referral. What a referral would be is that, the animal, that client would see their general practice doctor, so their regular DVM, their regular doctor, and then they would get a referral. So, such and such is going on, and I need to send this kiddo to a specialist, someone who is board certified in this particular area. And so they have more knowledge and more expertise. So that might be like dermatology, ophthalmology, internal medicine, so on and so forth. And we'll get into those. They can definitely, doctors can specialize in certain areas. CVTs can as well. So, if you do continue on to get your associate's degree in veterinary technology, you sit and you take your national and your state boards, you can get those letters behind your name, that's CVT. And then you can also get more letters behind your name if you specialize. So for example, like emergency, I talk about emergency a lot because I love it. They get the letters ECC, so emergency and critical care. And then certain specialty centers, they can just do one or they can do a bunch, really just depending on what they have and who they have. So for example, VSCOT, and this might have changed a little bit more recently, but I haven't quite checked in on them yet. They definitely have dentistry, dermatology, they have diagnostic imaging, so more advanced diagnostic imaging. Definitely emergency, they're open 24/7 and they haven't closed in years, if not decades. Internal medicine, neurology. I think Dr. Alcott actually retired, so I don't know if they have neurology anymore. But ophthalmology, so checking out the eyeballs, surgery, and then valley fever. Excuse me. So valley fever is actually pretty cool that they have that specialty, and it's Dr. Schubitz. And last I heard, she's actually working on a vaccine. I don't know how quite that's going to work because valley fever is a fungus, but she is very, very, very smart when it comes to patients with valley fever, which we see a lot of because the Southwest United States is the most common place for that. Tucson being like the hot zone. So moving on to SAB, so Southern Arizona Veterinary Specialty, they do things like dentistry, dermatology, emergency, so they're also open 24/7, internal medicine, oncology, so treating cancer patients, ophthalmology, and surgery. And so some of these can kind of go hand in hand, right? So, if a patient comes in with an eye condition and we need to remove that eyeball, then we can go ahead and take them to surgery. So this top one here, it's going to be SAVs, and then this bottom one is VSCOT. So they have that emergency entrance right there. So some mixed practices moving into patients of different species being seen at the same place. Valley Animal Hospital, or VCA Valley, does see dogs, cats, birds, reptiles, rabbits, ferrets, definitely some wildlife and zoo animals. But that doctor really has gone on to a different clinic, so they're not quite seeing a lot of those. But they've definitely seen like pigs and things like that. One doctor I heard even sees bats. And that was pre-COVID. Not quite sure he'd want to see them now. We have Central Animal Hospital, which is going to see, of course, companion animals and different exotics. Adobe, which is mainly companion animal and livestock. So they have the small animal mixed with a large animal. So a lot of these pictures are going to be from Adobe because they need larger facilities for larger patients. We then have spay neuter clinics, so they're going to be low cost because all they're doing are the basics. So spay neuter, they're going to vaccinate the animal, they're going to trim the nails, they're going to microchip, but they're not going to do anything like, advanced imaging, illness workup, other things of that sort. They are very different from regular full service clinics, so they're going to see or do maybe 40 to 80 surgeries in a day, which is quite a lot. So again, new diagnostic machines, they are not going to do high-end monitoring devices. They're just kind of in, cut, out. They're not going to do a lot of medication. So they may do some comfort medication, some tranquilizing medication to help sedate or calm the patient whenever they leave, but they're not going to do a lot. They're not going to have an isolation ward, so they can't accommodate things like parvo or Khaleesi or things like that, or do any full service in that capacity. So we have Humane Society is a big one, Arizona Spay Neuter, ABC or Animal Birth Control, and then Eastside. Okay, next up are mobile clinics. So clinics that can physically move to the client. So these are pretty cool. So a lot of times there are going to be large animal vet because who wants to haul a cow into a clinic? Not me. I don't know about you. So we also have vaccine clinics, which are pretty cool. So out in, I think it's Picture Rocks, about once a month, there's a vaccine clinic. So they head out and they vaccinate as many animals as possible, and they're very low cost. There's also some euthanasia services. So, like Home at Last is a pretty big one here in Tucson with Dr. Kirk. She's very nice. I've heard nothing but great things about her. And then general care. So, they are going to be equipped with at least some things so that way they can accommodate certain illnesses. So, in this case, this is a large animal veterinary truck. They've got things like some nursing supplies, so stuff for venipuncture, bandages, medications, ointments, different things that are going to do basic services, but of course they're not going to have certain diagnostic machines. They might have a portable x-ray machine, but they're not going to have like blood analyzer machines in their truck. They aren't going to have like a CT machine. They might have equipment to do some basic surgery. So if there's like an abscess, they can lance that in the field. Certain surgeries are going to require actually taking that animal into a clinic or a hospital. And then here's an example of that vaccination clinic. So really they're just, hey, is your pet doing well? Great, let me go ahead and give it some vaccines. If there is any illness or concern arising within that patient, then they're probably going to refer them to a full service clinic. So I used to work at a general practice clinic, and actually there was a couple of times where the doctor doing the vaccination clinic would decline patients because of, one of them ended up having demodectic mange. So you definitely don't want to vaccinate for whenever they're undergoing that kind of illness. And then one of them also had an issue with its eye. I can't quite remember, but if there's any illness going on where that doctor doesn't quite feel comfortable about giving that vaccine, they'll just say, you need to go to your doctor. Maybe come back for vaccines later, but there's something going on and your pet can't get vaccines right now. Okay, so in terms of demographic data analysis, so what clinics just do or think about whenever they're deciding where they want to be, they are going to perform some sort of analysis. So they're basically going to survey the area so that way they know what are our clients, what do they need, what do they want, where can we fit, things like that. And so that'll allow people to adjust their business based on what'll fit for their client. So, seeing as though we're the U of A town, we aren't going to put a large animal vet, like a very large animal hospital, right next to the U of A campus, because college students just simply aren't going to have cows, horses, goats, sheep, pigs, all that fun stuff. So that's just not feasible. That's not fitting for the demographic. So, we might put a large animal vet on the border of Tucson, heading out to like Marana, Casa Grande, where there's more land to have livestock. And it's going to be more feasible for those people because they're going to have the large animal they want to choose someone that's close, right? The AVMA even told us that most people choose their clinic based off of location. So we want to make sure that we're accommodating our clients. That way we can get clients. Okay, so now we're going to go from talking about the different types of practices and the different entireties and talk about what's actually in them. Because you guys, a lot of you probably haven't seen the inside of a vet clinic, at least from a technician standpoint or an assistant standpoint. You've maybe seen it from a client standpoint. There are some areas that you're going to be familiar with, but some that I want to make sure that you're aware of before you get straight on and head into the field. So of course, we're going to have that lobby. We can have exam room or rooms. A lot of places will have multiple, even if there's only one doctor. The treatment area, that's where the hustle bustle, that's where things happen. That's where the magic happens. We then have the surgery suite, which is going to typically be like off of the treatment area, and it'll have a door. So we can shut it and make sure that it stays clean. Of course, we're going to have kennels, different sizes as well. We'll have an isolation ward. Remember, some places won't necessarily have isolation if they're not full service, but isolation is typically in a separate room. It has a separate door, ideally a separate ventilation system, and we'll talk more about it. Radiology, again, typically they have a door. The lab area, not always needing a door because typically we just have some machines and a microscope and things like that. And then pharmacy. In my experience in different clinics, a lot of times that pharmacy is actually in the cabinets across from the exam rooms. So that lobby is the reception area. It's where clients get their very first impression. We want to make sure that we are keeping this area clean. So we're monitoring it for messes. We're never leaving the front unattended. So one of the things that I heavily recommend for all of you guys looking to be VAs and VTs and CVTs is to make sure that you can be plugged in anywhere in the clinic, anywhere in the hospital. So having that friendly face and that welcoming presence and being able to answer questions from owners and talk to owners and have that pleasant conversation with them is going to be super, super important about making you more employable, um, making you, the best employee that you can be and the best technician and assistant you can be. So in that reception area, there may be some times where even if you're like, man, I didn't take this job, or I didn't go to school to answer phones. That's not quite the only thing that the receptionists do. So you might be asked to fill in on occasion, and it's not the worst thing in the world, I promise. I personally couldn't do it full time. Power to the receptionist because they do a job that I physically and mentally and emotionally could not. Um, the one thing that some clients do is they'll call them the girls at the front. Oftentimes they are female. This is a female predominated field, but they're not always. So I always make sure to call them receptionists, never front desk ladies, things like that, because we want to make sure that they have a respectable title from us. We're setting the example. We're respecting our receptionists, we're respecting our front desk staff because they are part of the team. They are a very, very vital part of the team. And without them, nobody would come in, right? Nobody would be scheduling appointments. Nobody would be actually checking people in, checking people out. So they are a very, very essential part of the team. In this lobby, there should have computer monitors, ideally not blocking whoever is sitting at the desk. So that way that eye contact can be made. Now, of course, that might be different with your clinic. Right now, there are still some clinics that are doing curbside due to COVID. Ideally, they'll have separate dog and cat waiting areas. I will say that not all clinics are large enough to have this separation. So one of the things that we need to consider whenever we have appointments on our schedule is to plan things out well. So, if we know that we have a cat coming in, we probably want to get them put into a room pretty quickly because that cat sitting next to that dog is going to get more stress, and then it's going to make our life difficult. It's going to make them more stressed, and they're going to have not so much a pleasant experience. We want to make sure that there are client information, brochures, business cards for places that we trust and refer people to. So training is a big thing. I give out training business cards all the time because that is not something that I am skilled in any way, shape, or form. So I want to make sure people have the right resources. We're also going to have a large dog scale. So, big dogs, of course, we can weigh them and then make sure that there's no smells or unpleasant odors. So making sure that we are cleaning everything. Everyone is responsible for cleaning. Don't let anybody tell you otherwise. Everyone is responsible for cleaning. If you see a mess, just clean it. If you see something that needs to be done, just do it. Okay, so here's some examples of lobbies. So again, every place is going to be different. VScott has like a couple areas in the lobby, a couple different lobbies because of their specialty, but they're also emergency. So on the right hand side, it's the specialty lobby, and then on the right bottom is their emergency. So different areas because, of course, if you have an animal that's just waiting to be seen for increased eye pressure, we're not going to want them to get even more stressed by the hit by car or the snake bite or something like that that's coming in through the emergency room. Then we have exam rooms. So, as VAs, you guys will spend a lot of time in exam rooms, so it should be comfortable. Our clients are going to be spending all of their appointment time in there, except for when they're possibly waiting in the lobby. So we want to make sure that we're cleaning it after each appointment. So even if the exam table wasn't used, it needs to be cleaned. A lot of times people will not put a patient on there, but they'll put paperwork and they'll do signatures and payment and all that fun stuff on the table and then not clean it afterwards. But we want to make sure that we get that area clean. I don't necessarily personally empty the trash after each visit, only if there's something odorous in there. So any pee, poop, bodily fluids, things of that sort, then I'll empty the trash. Otherwise, just make sure that it's not overfilling. And then supplies should be stocked typically at the end of the day. But whenever I open the clinic, I always like to just check and make sure nothing needs to be topped off last minute before I start for the day. So in that exam room, we'll of course have our exam table, and sometimes they can fold up, sometimes they're stationary. I'll show you guys those differences. We want non-upholstered chairs, so stuff that can be cleaned nice and easy, right? We never know what's going to happen. A sink, a counter is nice, cabinets with drawers stocked with things that we need for exams. Biggest thing is never keep sharps in the exam room. So no needles, syringes, catheters, microscope slides, anything that can cause a puncture wound. Because think about that 5-year-old that's going to go and open everything up, and then that mom that's worried about her cat or her dog or something like that. She's not going to necessarily pay attention to them, so we need to make it as safe as possible for those guys. Paper towels, because we're going to use those to clean, or if your clinic uses rags instead, whatever your clinic uses to clean. A sharps container. If a clinic is still using film for x-rays, we'll have a viewing box for that. And then typically like a peephole or a window or some way to look in at the client and the animal. So we've got on the top left, you can see the radiograph viewing box on the wall, as well as the top right. And then in that top right, you can see that that stainless steel table can actually fold upwards against the wall. So it can get out of the way. So say you're dealing with like a Great Dane, you don't want that table in your way. I can tell you I've donked my hip and my back on that quite a few times. And then moving down, we can see that some of these tables are going to be stationary, so they're not going to go anywhere. Oftentimes, your clinics will have a computer, or at least oftentimes they'll have a computer in that exam room. You can be documenting, you can be checking them out, all that fun stuff, scheduling the next appointment, whatever it may be. There's a lot of reasons to have a computer. So then the treatment area, of course, that's the busiest room, very high traffic, where all the magic happens. So we might do things like triage, emergency, basic, quick procedures. So like nail trims, vaccines, clipping cleans, different things like that. You name it, there's a lot of things that can happen in the treatment area. We can also do non-sterile surgeries. So, dental cleanings, right? The mouth is dirty, but that doesn't need to go in the surgery room. We can also do smaller surgeries like a laceration repair, a small mass removal, kitty neuters. We'll go through that in surgery. Those guys are quick. It's like 2 to 3 minutes tops. And then we don't want to dirty the whole surgery room just for that. So that treatment room should have access to everything. So we want that exam table, we want a wet table, overhead lighting. You guys would be surprised how much light helps. One of the things I always love to do as a doctor, if a doctor is doing like a small surgery or something on a patient and they don't have light already on them, I always like to just kind of, as I walk by, just turn on that light and shine it there for them. You'd be surprised how much it can help. An anesthesia machine. Sometimes clinics might have multiple available. The biggest thing about making sure that we have that available at all times is sometimes we just want it for the oxygen purpose. So if we have an emergency patient that we need to get oxygen to, that anesthesia machine will actually allow us to do that without fully anesthetizing that patient. So we don't have to give anesthesia when we're giving that patient oxygen. And then a treatment board. And again, that's going to heavily vary. So over here, that top left is VCA Valley Animal Hospital before they got a remodel. Right now, it is much heavily more vamped than that. That top middle is going to be VScott, so the specialty center. I'm not quite sure what that top right clinic is. Actually, I'm not sure about a lot of these ones, but the bottom left is Paws. So they do their general practice, but they also do things like rehabilitation. So water treadmill, acupuncture, some Eastern medicine, so lots of herbal supplements, things like that. So if you're interested in that kind of treatment and therapy, that might be the place for you. That's not something that I necessarily had an inkling towards, so that's not anywhere I've worked. Okay, moving on to the surgical suite. So that's where sterile surgeries are going to be performed. So if we need to like go into the abdomen, we definitely want to do that while we're completely sterile and completely clean. This is going to be always the cleanest room. So whenever we're like cleaning for the night or cleaning after your leave or like when you're about to leave for your shift, we always want to make sure that's clean first. So right as soon as we get that mop water and that mop head ready, that's the first room we're going to clean because we don't want to drag anything from like the lobby or the treatment area into that surgery suite. We always want to make sure that supplies are stocked because you would hate to have a doctor that is scrubbed in a patient needing something and you don't have it. You don't want an upset doctor. Angry doctors make for bad situations, but you only want to keep in the surgery room what you need. So, sometimes depending on the doctor that I'm working with, if I know that they want particular things that are typically kept outside of that surgical suite, so like in the surgery prep area, I'm going to make sure that I grab those and then have that ready for that surgery. Like I had one doctor that anytime he asked for one suture, just I would always just grab two because I can't tell you how many times he just dropped the whole suture pack. That surgery suite should have the table, the lights, the anesthesia machine, supplies, a crash cart because we never know when a death will happen. We want to make sure that we're fully prepared for that. Sometimes we'll need a stool. Not all doctors sit during surgery. It's actually pretty rare, but you will have that occasional doctor that would want to sit during surgery. And then everything needs to be on wheels. And the reason for that is think about how clean we need this place to be. We need to move things to get them out of the way to really make sure we can clean behind everything, under everything. We're going to clean the tops of the lights. We're going to clean even that kitty picture frame. We're going to clean the top of that. Everything has to be absolutely clean. This is the most sterile environment that we're going to have in the entire clinic. So that left side, we're going to see, of course, we have our anesthesia machine, we have monitoring equipment, we have that table, and the tables work almost like the hairdresser chairs where they have like a little pedal at foot level and you can pump it and it raises it for your doctor. And then if you press and hold it, it's going to lower that table for them. So sometimes you will have to do that while they're in surgery and adjust the height for them based on how tall or short they are. And I don't know all of these pictures, but I do know that top right one is also VSCOT. They've got a very big surgery suite and a very big surgical area because they do a lot of surgeries, definitely. So moving on to the kennels, this is where animals stay whenever we're not actively working on them, but they're either outpatient, inpatient, hospitalized, all that fun stuff. So we're going to have large runs for large dogs because we can't expect them to fit in a small kennel. We want non-porous flooring, something that's nice and easy to clean. But especially for those large runs, it'll have like a hose and a floor drain system. So rather than going in and like cleaning with a rag and cleaning that entire run, which is about as big as like a shower stall, a lot of the times, we just want to be able to hose it down, maybe scrub it with a brush, like a big brush, and then hose it back down. A lot of times they'll have an exhaust fan, like a separate kind of ventilation system. And then the cat ward, on the other hand, should be quiet. Cats get stressed very easily, so we want to make sure it's nice and quiet. Ideally, if we have a patient that's hospitalized and we're not actively working in the cat ward, I do like to turn off the lights as well. And there's a lot of things we can do fear-free wise to make sure that our cats are staying comfortable in hospital and we're not increasing their stress level because of improper techniques. And then of course an exhaust fan as well. So these are going to be some dog wards. These guys have, whiteboards, that way the patient information can be written on there. I like using whiteboards, at least if they're smaller or like, just an index card. So that way we can write, the patient information, what they're hospitalized there for, who's the doctor, who's the technician. So that way if there's any issues, we know exactly who to go to. Then we have the isolation ward. So it's also separated off the treatment area very slightly. This is for hospitalized patients that have contagious, or what I like to refer to as communicable diseases. So a disease that can be communicated or transferred to another patient. So we have to gown and glove up before entering. We also put on shoe booties. So those can look different. We can actually put on like physical like booties like you do in surgery, or some clinics, because they do a lot of isolation work, they might have, kind of almost like tape that you attach to the bottom of your shoes and you just rip off and throw away whenever you're done. Laundry is going to be done separately with bleach. So especially if we have like a parvo patient or parvovirus dog, then we're going to probably wash it with bleach 3 times, or at least wash it with bleach a couple times and then wash it regularly and then dry it on high heat, because parvo is very, very, very hardy, very hard to kill, and it can be quite deadly to our patients. So we want to minimize that spread as much as possible. The golden rule definitely about the isolation ward is what goes in isolation stays in isolation. So do not bring that pretty pink diamond jeweled pen into isolation because it's going to stay there and you're going to lose it. Don't bring your good stethoscope in there. Things like that that you don't want to have to leave in there, don't take in there. So sometimes isolation wards will have a separate entrance and exit. It's really just dependent on the size of the clinic. VCA Valley that I mentioned earlier, they actually have their isolation ward is gigantic, has a separate washer, dryer, sink. They have a GI isolation, so gastrointestinal, and a respiratory ward. So they're even separated between those two types, and they do have a separate exit. They might have like a foot bath or a bleach towel outside the doorway. I'm not a big fan of that because what a lot of people do is they'll take their little shoes, they'll put them into the foot bath or the towel, they'll dip it in bleach, and then they'll walk away on their merry way. Bleach, turns out, actually has a 10-minute required contact time in order to kill some of these diseases. So unless you're going to stand there or leave your shoes in there for that required contact time, you are just bringing around parvo to your clinic. So that's why booties are nice and handy and important to use because you can take the booty off. And if they're reusable, if they're not broken, I'll typically just hang it in the isolation ward. So I can just reach over, grab it, and put it back on my shoe again. But some of those are disposable, so you literally just take it off, you throw it away, and then you're free to walk around in your clinic. A lot of times we'll have grates in the kennels, especially think about these GI kiddos. Parvo is going to make them really nauseous. They're going to poop a lot. They're going to have lots of diarrhea. And we want grates that way all that can fall away from them. We don't want our patients sitting in their own excrement for any amount of time. It's really uncomfortable. It can cause sores and ulcers, and it can be really painful in the end. So for best care, the grates are really nice. Now, what you'll see here is that she's got like puppy pads in those kennels. What I like to do is actually I'll put a towel, typically a white towel, because then we can bleach it and it's not going to be stained. And then I like to layer a couple potty pads so that way, if my patient vomits or has some diarrhea or things like that, I can take that top layer and there's still bedding underneath. So that way I'm not having to take the patient out, change out the bedding every single time because these parvo patients are probably going to vomit or have diarrhea upwards of a dozen or more times a day. So I just like to make it as easy on myself as possible. Okay, next is radiology. So this is where radiographs are taken. They can be developed and stored, but a lot of clinics don't have film nowadays. So there's no need to develop them and store them. They're just going to be digital on the computer. Who we don't want in this surgical area is pregnant women because we don't want to irradiate the fetus, anyone under 18, and then anybody else who doesn't have a radiology badge. So clients especially. These are diehard rules. They cannot be broken. In radiology, we're going to have lead-enforced walls and a door. So even on campus, we have a small circular lead plate surrounding the doorknobs. That way, even through the screws of the door handle, that X-ray can't seep through. Of course, we're going to have the X-ray machine and table, the film light box if we have film. Sometimes they'll have kennels, although I've never actually seen kennels in radiology, right? We don't want patients to stay in radiology and continually be irradiated. We want to, if we're having film in our clinic, we want to make sure that we have a door that's going to stay light tight. So think about like in photography class, how they have that red safe light. That's okay to use. We also want to make sure that, that there's what we need to process that X-ray. So for the processor, it might be a whole machine. It might just be the dips, blank storage, an exhaust fan to take away those fumes, things like that. It's not that common though. I've never worked somewhere that had film. So this is what an X-ray table might look like. So there's that foot pedal. In most states, we are permitted to be in the room whenever we're taking X-rays because we have to restrain the patient in order to get our X-rays taken. Because try to tell a cat to lay there with its leg broken and not move for an X-ray. It's simply not going to happen. So we have to be in there when we take those X-rays. The cool thing about those tables is that they actually can move. And every X-ray machine might be slightly different, and we'll go through that further when later on in nursing. So then we have the lab area, and this can be in some large hospitals, an entire room. Oftentimes it's just like a counter or two, some counter space. So this is where diagnostic labs are going to be run, where the equipment is kept. So things like blood analysis, so CBCs and chemistries, and we talk more about that in lab. Urinalysis, fecal analysis, cytology, we can have microbiology. What we're typically not going to do in clinic is histopathology because that takes very special and very expensive equipment. We just simply don't have that in a clinic. What else we're going to want is a refrigerator. So a lot of our samples do have to be kept in the fridge. So things like pee, poop, blood, all that has to be kept nice and cold before you run it. Of course, the analyzing machines, microscope or multiple, centrifuge, which is going to use centrifugal force to separate heavy things from light things. So basically, it spins really fast. We have cytology stains and typically a sink. So this is Pause Lab. So they have a couple of microscopes. You can see off to the left, they've got their blood analyzing machine. They have the availability to do stains right by the sink. Stains are toxic, so they're actually are caustic to the skin and to the cells, and it stains really easily. Pro tip though, alcohol is super helpful for getting stains off. If you like get stain in the sink or something like that, but absolutely do not get it on yourselves. We have gloves, we have protective stuff that we can wear. Okay, moving on to pharmacy. So this is typically a little bit closer up to the lobby. This is where non-in-house prescription medications are kept. They are in alphabetical order a lot of the times, but they're typically going to be alphabetical order within their therapeutic class. So we might have like NSAIDs or anti-inflammatory drugs, and then they're going to be alphabetized from there. We might have medications for the endocrine system or endocrinopathies, and those are going to be alphabetized from there. Different allergy medications, and those are going to be broken down into their bits. Antiparasitics is a big one, so that might take like a whole shelf or two. So of course, we're going to have our medications. We're going to have pill vials and containers. So things like amber bottles, Yorker bottles, all that fun stuff. We talk about more in pharmacology. Computer, so we can actually make the prescription, print the label, and then different things for actually filling prescriptions. So maybe a scale, syringes, measuring spoons, a mortar and pestle if we need to crush that pill. I like to use syringes a lot for like exotics, or if it's a small amount of liquid that the owner needs to give for a dose. So say if it's like they need to give 0.07 mils, that is pretty dang difficult for an owner to accurately measure without the proper training that we go through. So I often like to pre-measure that for them and then send them home with each, like with multiple syringes. So it's give one syringe once a day, which is a lot easier than trying to measure up the amount and then giving that once a day. I definitely don't want them to have to accidentally overdose or underdose their patients. So this can look very overwhelming at first. Basically, whenever you go to a clinic, you'll kind of just start to get the hang of where things are. You might ask questions. You might just take a minute to try to find something. And then once you know where they are, you know where they are. There's that fridge right there. Some medications do need to be kept in the fridge. So like Tresiderm is an ear medication that needs to be kept in the fridge. And so when we're dispensing it to our owner, we also need to make sure that they keep it in the fridge. What I like to do is send it home with some ice. So that way it reminds them whenever they get home, oh, this is cold. It needs to go in the fridge. But also then if they forget, they've got a little window of time that the ice is keeping the medication cold. So they don't have to necessarily stress too much. Although I still have had people forget to put it in the fridge and then it goes bad, which is unfortunate because then they have to purchase it again. Okay, inventory is everywhere. So everything in the clinic has to be accounted for, even coffee creamers and things like that. So it may be one staff member. So at a couple of my clinics, there was a designated inventory manager, but everyone needs to pay attention. So what one of my clinics did, which was really beneficial and really helpful, was there was a little sticker paper that said last one on it. And so the last one of that kind had that. So as soon as we opened it or started using it, then we would just take that little slip of paper and we'd be like, here you go, boss. We need more of this. And they'd be like, okay, I will go order more. So that was really, really helpful. Not every place does that. Some places, the individual inventory managers like to just go around and take inventory. But the other thing we also need to pay attention to is expiration dates. So, especially when we're sending home medications, we need to make sure that we're not sending home medications that are close to expiring or expired, or if they're broken in any way, shape, or form. So, if we are sending home a year's supply of heartworm prevention, but it expires in 7 months, we can't send it home, right? Because by the time that they get to month 8, and then it's expired. Some of the major suppliers we have are MWI, Henry Schwein, Patterson, things like that. So we do have inventory software to help us with this. So, a lot of time the software that we use for our records will do billing and inventory. So, if we bill a client 20 pills of this kind, it'll pull 20 pills from our inventory. Okay, we don't necessarily have machines that look like this. This is more of like a human medicine thing, but your inventory, areas, shelves, storage areas might look different. So every clinic is going to be a little bit different in what they prefer. Okay, some other areas that we have in a clinic are going to be places like storage, laundry, the kitchen. So it might be, like the break room kitchen, but it might also be a patient kitchen. I've worked at clinics that, they're the same area, but I've also worked at places that are different. We have our surgical prep areas. So for autoclave for surgical packs, we'll have an office, we'll have bathrooms, a break room, a yard, so like a dog yard in order to walk them and things of that sort. But we'll also have um like single places like an office, so it might be doctor's office plus or minus just the manager's office. Okay, again, all employees are responsible for keeping this stuff clean. Nobody is above cleaning. This is actually the outdoor area for, yet again, Pause. Pause is a beautiful facility. Okay, now we're moving on to ocean safety. And bear with me, it's not the most fun thing in the world, but it's definitely necessary to have a good foundation of as you head out into clinics so you know what's expected of you, you know what you can expect of your employer. So OSHA means Occupational Safety and Health Administration. That is really important to know. Their job is to regulate and enforce federal law. They're going to ensure a safe workplace. So that occupational safety is a right. So it is a right of yours to be safe in the place that you work. So even hazardous jobs have to meet reasonable safety requirements. Okay. And again, it is protected by law. So they have to follow these rules. They have to make sure that you stay safe. Okay, so OSHA requires that employers will have that program that will educate employees of health risks. And you're going to have to go through this OSHA training every clinic that you go to because every clinic is responsible for making sure that you know these things. They're going to provide necessary safety equipment. So we'll talk about PPE and what that means, but they are required to have certain devices, equipment, things that you can wear, things that you can use in order to stay safe. And then they're also going to have to train you on how to use it because it's not enough to just say, here's a fire extinguisher. They also have to show you how to use it. Make sure that you know that. So they will also be required to have things like posters. Most of the time it's posters and pamphlets that will warn of hazards in the workplace. So where do you come in? You guys have to bring hazardous conditions to your employer. If you see something that's unsafe, it is your responsibility to say something because your manager's not going to walk around the entire clinic every day. They're not going to know that something might be dripping and leaking and that there's water seeping on the floor that becomes a trip hazard. If they don't fix it, then you can file a complaint with OSHA. Remember, they're there to regulate and uphold the federal law. Then they are entitled to a certain amount of time to fix that. So, if you're like, man, the washer's leaking water, it's becoming a trip hazard, and you tell your manager and they're like, yeah, I'll fix it, and then they don't, and then you file a complaint, well, they still have a little bit of time to fix it, right? Because that's the ultimate goal, is to make a safe workplace. Again, you have to inform your employer of anything that's going to affect your job safety. So if it didn't happen at work, it still counts. So, say you were on an ATV ride and you broke your ankle, right? Your doctor puts you on a lifting limit of less than 50 pounds. That's important. Your clinic needs to know. Pregnancy is a medical condition. Remember, there are things that you can't do when you're pregnant. You can't be exposed to radiation. You can't be exposed to anesthetic gases. You probably shouldn't be cleaning like cat litter boxes, and we'll talk more about that in lab. Different things like that that you should not be doing if you have certain medical conditions. So for safety, so who needs to be protected? Everybody, right? So clients, our patients, ourselves, our managers, our doctors, the technicians, the VAs, the receptionists, absolutely everybody needs to be protected, okay? So safety will protect people from those hazards. So hazards are going to be conditions that will cause injury or illness. So an injury is going to be defined as a physical trauma, or an illness is any physiological disease or condition that will negatively affect the body. So basically a hazard is going to negatively affect the body either, either from, direct trauma or insult, or a disease process that is going to cause that insult. So common hazards are going to be things like when you lift an animal, you can get back injury. So if it's more than 50 pounds, definitely get help. If it's more than 50 pounds, grab a friend. Back problems are real, especially in veterinary medicine. You can get back problems starting at a very young age. Handling animals can lead to bites or scratches. Wet floors can, of course, lead to slips and falls. And then anything that's sharp that can cause a puncture wound can cause a puncture wound. So we want to make sure that we're handling all those appropriately and doing proper safety measures. So things that can cause illness would be, of course, handling animals, different zoonotic diseases. And we'll talk about a couple. Taking radiographs, so radiation can cause cancer, especially if you're looking at those x-rays as they are being emitted. You can get things like cataracts and actually lose part of your vision. And then handling chemicals, things like, remember, cytology stains are going to be toxic. Of course, we have different things like chemotherapy. When you are mopping, it is important to put a wet floor sign down to help avoid slips, falls, trips, all that fun stuff. Sharp containers. Now, contrary to popular belief, the container is not sharp itself. It is meant to contain things that are sharp. Again, anything that can cause a puncture wound. So anything glass or thin metal, so like needles, glass files, things like that, we want to put in these sharps containers as to avoid injury. Scalpel blades, of course, they're meant for cutting and they're not biased towards one type of tissue or the other. We want to make sure that we don't overfill these. So there's going to be a fill line on that sharps container. So we want to make sure that we're following those directions. And then don't ever put your hand into the sharps container, ever. Of course, keep it out of reach of children. And that is important to note for the sharps containers that are in the exam rooms, right? We want to make sure that they're up high so that way kids cannot get them. What else happens with kids and dogs in a building? Well, noise. Things like barking could definitely damage your hearing. So if you're working in a place and that has lots of dogs, either dog ward, kennels, if your clinic has grooming, then you want to make sure that you have the right equipment to help prevent any harm from that level of noise. So, if you bring that concern up to your clinic or to your manager, they should make a reasonable accommodation, typically earmuffs, and they do. I have seen clinics purchase very noise-proof, not headphones, but headphone-shaped earmuffs. That way they can protect the hearing. Fires. So after every single load, we need to clean that lint trap. There's a lot of fur, there's a lot of dust, there's a lot of things going in that dryer that we don't want to cause a fire. However, if there is a fire, do not be a hero. So you need to alert others and you need to leave. So that means, if you are in, say, an exam room and it is faster for you to leave through the lobby and get outside, you do not go back to treatment and pick up a patient. I am sorry, but you do not be a hero. However, if you are in treatment, you are right next to a kennel and it is not going to put you out of your way to grab a dog, personally, I'd grab that dog and I would take off with that dog. Make sure paths aren't blocked. So anything that says fire exit or is the exit, make sure it is exitable. And then know where your extinguishers are. Again, that's something that your employer will do with you for OSHA training. So a lot of times, and I've done multiple of these at this point, they will have, an entire pamphlet or a packet to fill out. And they'll be like, where are your extinguishers? Where are you going to meet in case of a fire or an emergency where we have to evacuate the building? Is it going to be in the front of the hospital? Is it going to be in the back of the hospital? And then along with fire extinguishers, remember to pass. So how we're actually going to use the fire extinguisher is we're going to pull that pin, aim the nozzle, you're going to squeeze that trigger, and you're going to spray and sweep at the base of the fire. If you spray, sweep at the top, yeah, it looks cool, but it ain't going to do anything against that fire. You have to put the base of the fire out. You put the base of the fire out, the whole fire goes out. So in that event that you are able to extinguish the fire rather than having it spread to the whole clinic, just make sure that you're safe in doing so. Moving on to mechanical hazards. So any machine that has moving parts can be hazardous. Even ones that, like, oh, I don't have to put my hand in this machine while it's running or things like that. It can definitely still be hazardous. So when we are doing certain lab tests, we have to use the centrifuge, which, remember, it spins really fast. So we are going to make sure to latch them properly, and we're not going to put our hand on it or near it whenever it's spinning. We're going to wait until it's completely stopped. We're not going to hit that brake button to get it to stop spinning sooner, right? We're not going to hit that brake unless it's an emergency. We don't want to wear loose clothing or jewelry. So a lot of times in clinics, what they recommend is just wearing rings. Not even to wear bracelets, necklaces. If you wear earrings, wear stud earrings, because you don't want anything to get caught. And long hair, keep it pulled back. Ideally, just keep it up all the time. And then to minimize the use of extension cords, only for a trip hazard, but we don't want to get electricity where we don't want it. So such as like a sink. Then we have compressed gas tanks. So things like oxygen, nitrous oxide, most of the time it's going to be oxygen. They have to be chained to a wall to keep them from falling over. These guys have so much pressure in them. So think about your average tire is about 35 psi or pounds per square inch. These guys will come to us with over 2,000 pounds per square inch. If you've never seen Mythbusters, they did an experiment to how strong these torpedoes can be, and they torpedo through brick walls. They're going to torpedo through your legs. We need to be careful with them. If we are moving them, if we are changing tanks, we have to be careful. So that is something that you guys have to do in the tech program whenever you're going through that surgery class, switching out those tanks. But if you are not confident, especially using these big guys, because these are like 4 feet tall, get some help. Other things to help keep us safe are these lead gowns in terms of radiation, but we don't want to fold them. They are made of lead, they are made of metal. Metal can break if it folds. So we want to make sure that we are hanging them properly and immediately. Those folding of them can actually cause cracks and breaks and can allow radiation to leak through into us, right? We definitely don't want that. Well, then we have zoonotic diseases, of course. So since we're working with animals, we want to be privy to the diseases that can spread from animals to humans. So, we're at risk of contracting those. So patients are also at risk for contracting what's called a nosocomial infection, which is an infection acquired in the hospital. So, if that patient is hospitalized and their bedding isn't cleaned in proper time, then they can acquire a nosocomial infection. So the best way to prevent these things is to sanitize everything regularly. The biggest thing that we'll talk about when we talk about our cleaners is contact time. Everything is going to be slightly different. So we just want to make sure that we're aware of what we're using. So you can read the label, you can ask a friend or a colleague, but we want to make sure that we're sanitizing things properly. So since these can be transmitted via urine, feces, blood, skin, saliva, we want to make sure that we are, taking away any organic tissue or excretion. So, if it's poop, then we want to actually physically pick up the poop before we clean the area that was pooped upon, right? So, the most common one that we use, and we'll talk about it, is rescue. It takes 3 to 5 minutes for that to kill things. So we're going to pick up the poop, we're going to spray our rescue, and then we're going to walk away and come back after a few minutes and then finally clean that up. because we gave it that contact time. Basically, it has to sit on that sample or where that disease possibly is being transmitted and kill anything that is there. So other ways that we can minimize the spread of zoonotic disease is obtaining health certificates before traveling. So, if we're sending a patient to like Hawaii, they don't have rabies, right? So they want to make sure that they do not get rabies. So to get a health certificate, an animal has to be examined within 7 days of travel. So certain countries are going to be a little bit harder for an animal to get into. So like Singapore, it takes a couple of months to meet all the qualifications based on vaccines, testing, all that fun stuff that has to happen. So all that has to be planned in advance, and then they have to have that health certificate and that exam within 7 days of leaving. And then another way we can decrease the spread is to keep our food and liquids away from the treatment area. So not keeping them in the treatment area where our patients are, where that possible disease transmission is going to happen. So that way we don't have all of those samples potentially ending up on our belongings where we're going to inevitably ingest them or be exposed to them. So in this case, she is doing a dental cleaning. So she is wearing proper protective equipment, which we'll talk about a little bit more, but she is completely staying covered. She is protecting herself against things like aerosolized bacteria. She's got gloves. She's got the goggles protecting her eyes. She's got a mask protecting her from breathing anything harmful in. So she is wearing good PPE. She's also wearing a long sleeve, so none of that contaminants is getting on her arms here. So, in regarding cleaning products, I told you rescue is the biggest thing, and the cleaning product is actually called rescue, but we want to use it according to the manufacturer direction. So, it does need to be diluted oftentimes, so we have to make sure that we're using the appropriate dilutions. We want to add the water first and then the chemical to make sure that we're doing the proper dilution. We want to store liquids at or below eye level. You don't want to have to reach up and spill it on your face because nobody wants to have to flush their face out. We're never going to mix disinfectants because we can have unforeseen circumstances. So ammonia and bleach makes mustard gas. And I don't know if you guys remember that from history class, but that'll kill people. So we definitely want to make sure that we are not mixing those things. We also have other chemicals, which are going to be more so medication, so isoflurane. We want to know how to check anesthesia machines for leaks. We should not be able to smell that gas, although in surgery, if you guys want to, I will expose you to that smell at a very, very, very low dose that does no harm to you. So things like faulty hoses and tubes, old seals, if it wasn't attached correctly, that can expose us to the smell and expose us to this agent. So this is an anesthetic agent, and when inhaled, it will actually anesthetize. So it'll put a patient to sleep. So we can also have this exposure from an endotracheal tube that's maybe too small for the patient, so that wasn't properly fitted. We also have ethylene oxide. So this is a gas that we use to sterilize certain hospital equipment. So things that can't withstand the heat and temperature and steam of a regular autoclave. So this is a known carcinogen. So this will cause cancer. So, if it's used, if it's not used correctly, then we have to vacate the whole premise, right? Which imagine if you are a hospital and you have hospitalized patients, we can't necessarily just rip them out. So most clinics won't use these. I did work at a clinic that had it, and there was a couple people that were trained to use it, and nobody else touched it because they had a whole binder on proper procedures and protocols. They knew what to do, and nobody else did, and so we just left it to them and let them be safe. We then have formalin, which is also called formaldehyde. This is a 10% buffered formalin solution. So this is going to preserve tissues for biopsies. It also is a known carcinogen, so it can cause cancer. So rather than having our jar, putting our sample in, we're going to use something like a forceps and drop it in. But we're not going to drop it from too high because we don't want it to splash. So we're going to kind of I typically just scrape it off on the jar and let it fall in. And then I'll screw the lid on and make sure the formalin completely covers that tissue sample. Okay, honorable mentions in terms of hazardous chemicals and drugs and liquids are chemotherapy drugs. So there is specific protective equipment to prevent ourselves from being harmed by these agents. Cytology stains we briefly talked about, and then of course there's going to be a ton more in clinics. So how do we stay safe? PPE. So PPE means personal protective equipment. So again, OSHA is going to require employers to provide necessary PPE or personal protective equipment for their employees, and remember, and train them on how to use it, because it's not just enough to have goggles sitting in the clinic. They need to tell you when you need to use them. So employees then need to use that PPE when applicable. So again, it's not just enough for your employer to be like, okay, here's what it is, here's how you use it. You have to implement that knowledge as well. So if we're using things like X-ray chemicals, pesticides, or insecticides, we want to make sure that we're especially wearing gloves, the proper gloves. There are different gloves for like an exam, for surgery, for chemotherapy, things like that. So if you develop things like dermatitis or respiratory symptoms when wearing an exam glove, like hives potentially, you might be allergic to latex. There are alternatives like nitrile gloves that we can provide. You just have to let your manager know, right? Any medical condition that's going to cause you to be harmed, you need to let your manager know. Okay, so more things that can help you stay safe. Again, gloves for veterinary medicine, they don't need to be thrown in a biohazard container. I will say if you're in the isolation ward dealing with parvo or distemper or anything like that, then you want to put it in isolation trash. We want to change them between handling patients, but wash your hands after you remove the gloves, because the glove is only protecting this much. We don't know what got past that, but we also don't know if anything got under that. We want to make sure that we're cleaning our hands completely, even after we use chemicals. Again, wearing protective masks when dealing with certain toxic agents is going to be really helpful for our respiratory tracts. And I'll go through the ways that you know what to do. Surgical masks do not equate other masks. So you just have to make sure that you're following proper protocol. So if you get something in your eyeballs, yes, you have to flush your eyes for 5 to 10 minutes, and you have to keep your eyes open, ideally without screaming. But your clinic and your employer will tell you where these are, so you know where they are in case something like this happens. But where do we learn what PPE to use? We're going to learn that in the material safety data sheets. So we're going to call that MSDS or SDS. So this is to help workers with what happens in an emergency, or emergency personnel with procedures for handling those hazardous chemicals. And these are going to be for every single chemical, every single drug, everything in your clinic, even distilled water, even saline that's not going to cause anything harmful. There are safety data sheets for that. Granted, they're going to be fairly uneventful because it's not the worst thing to get saline in your eye. We don't have to wash that with water. But in the event that certain things do get in your eye, we want to know exactly what to do. So even more requirements. So OSHA requires that those MSDS sheets or those SDS sheets be readily available for anyone to look at in the business, especially employees and employers. So oftentimes they're going to be, in the back area, the pharmacy, or somewhere that's obvious and available. And we do have them in our classroom library that's very easily accessible to anyone that wants to look at them. So these manufacturers are responsible for creating the MSDS information that will actually come with the shipment of the medication or the drug or the chemical. Every substance or chemical in a secondary container has to have a label. So even distilled water, even saline, isopropyl alcohol, hydrogen peroxide, everything is going to have a secondary label if it's in a secondary container. So these are some of the cautionary signs that we might see on labels, and kind of what they mean. I do want you guys to review these and be familiar with them. So we have things like explosive, we have flammable, oxidizing, so certain gases or liquids, gas pressure, of course, those torpedoes, anything corrosive, either to metals or to skin, eyes. We have severe toxic. We have acute toxic, something like a health danger. So it can cause cancer, like a carcinogen, and then we have environmental. So things like possible aquatic toxicity. So if it gets put into the water, it's going to kill the fish, and along those lines. So something like the NFPA label is going to have 4 color-coded squares. So things like the blue is going to be a health risk, red is flammability, yellow is reactivity, and then white is like a specific hazard. So this is really for those professionals that are working in the field. Then we have the HMIS label, which is Hazardous Materials Identification System. This year, I've never actually seen one of these. I more so see our other type of label. But again, we have different color coordinations. This, for example, has our our hazard index and then images for personal protective equipment that might be needed. So again, it's going to tell you what you need in order to stay safe while using that material. The rating, 0 is insignificant, so 0 is nothing, nada, we're good. 4 is that extreme. So 0 to 4, and it's going to be listed in each of those hazard boxes. Okay, so that is going to conclude our veterinary practice lecture. We are going to talk about this more in class. So we're going to touch on the main points that I want you guys to know. But after this lecture, you will need to go and complete the knowledge check. It is based off of a pool of questions, so not everybody is going to get the same questions. But if you took notes throughout this lecture, then you'll be that much more successful in your knowledge check.